Welcome to Fundamentals of Nursing. Today we're going to review how to do your initial nursing assessment as you enter clinicals for the first time. You want to always remember, before you go into your patient's room, to wash your hands or use hand sanitizer. A couple things to remember as you begin your nursing assessment, and the first thing would be to establish what you want to call your patient or what your patient prefers to be called. I never want to hear you calling your patient sweetie, honey, any pet names. Your patient deserves dignity and respect, and I expect you to give that to them. So we're just going to start by performing our nursing assessment today. Knock, knock. My name is Sarah. I'm going to be your nurse today. Your name is Susie Black?
Yes.
What would you like to be called? Is it okay if I call you Susie?
Yeah, Sue or Susie's fine.
Okay. One of the things I'm going to do right now is I'm going to check your ID band, make sure everything matches. Can you spell your last name for me?
B-L-A-C-K.
Okay. And your date of birth?
7/24/70.
Okay. And then I also would check their medical record number with the sticker that I have on my chart. One of the first things you want to do with your patient is establish your patient's baseline pain. Where are their pain rates on the pain scale from 1 to 10? Can you tell me what your pain is today?
It's better than it was yesterday.
So how was it yesterday? On a scale of 1 to 10, with 10 being the most pain and 0 being no pain, how do you rate your pain?
When I cough, I'm still probably like a 5.
Okay.
But if I'm not coughing or having those little fits, then probably a 2 or 3. It's just mostly tight today.
Okay, and is that different? Is it better or worse than yesterday?
It's better than yesterday.
Another thing you want to remember to do is, even if your patient says, yes, they're having pain, tells you what the pain is, you want to know, how is that different? Is it better or worse? You want to establish a baseline. Is it getting worse? Is it getting better? You want to know where to go with the information that you've received from your patient. All the while you're communicating with your patient during this time, you can be assessing your patient's level of consciousness. That can just be integrated throughout your assessment. If you have question on whether or not your patient is alert and oriented, if they know, if they're oriented to place and time, then you can ask them specific questions related to that. Otherwise, you can just move on. I'm going to go ahead and get your vitals right now. Then I'm going to perform my initial assessment, and then we'll talk about the plan of care for the day. How does that sound?
Great.
Okay. Going to check your temperature. Your temperature is 97.6. One of the things you also want to remember is that as you develop findings in your assessment, don't just keep them to yourself. A lot of times the patients want to know, what is their temperature, what is their heart rate. It's okay to share those things with your patient. And I'm going to go ahead and just going to check your pulse here. While you're checking your patient's pulse, you can also be assessing their respiratory status, and at the same time feeling their pulse for, is it equal, is it thready, is it bounding, what does their skin temperature feel like. You can get a variety of assessments while you're just touching the patient, assessing their skin temperature. Do you have any pain while you're just breathing like this?
No, not really.
Then I'm going to go ahead and get the patient's blood pressure. Do you know what your blood pressure usually runs?
I think it's good.
Good. Do you know the numbers? Are you on anything for blood pressure?
No, I'm not on anything. Like 120/70, I think.
Okay. And while I'm waiting for that to come up with a number, I'm just going to go ahead and check your pupils. And I'm just going to check to see how your pupils react to light, okay?
Okay.
So just look straight ahead. Okay, good. So at the same time, while you're doing one thing, you can still be focusing and doing other things during your nursing assessment so you get things done in a timely manner. Your blood pressure is 109/70. Excellent blood pressure. I'm going to go ahead and I'm going to do my complete head-to-toe assessment. And there's really no method to the madness. Whichever way you want to do it is fine. There's no specific right or wrong way. As long as you get it done, A, in a timely manner, you're accurate, and you're sensitive to your patient's needs during that time. Okay, I'm going to go ahead and listen to your heart right now. The best way to listen to your patient's heart and lungs is to write on their skin, but for this intents and purposes, I'm just going to listen over the gown. Do your aortic, pulmonic, tricuspid, and mitral. Now I'm going to go ahead and I'm going to listen to your lungs. Deep breath. Remember, as you're listening to your patient's lungs, you're wanting to compare your lung sounds bilaterally. And also, if your patient is able to, you want them to sit up and listen to their posterior lung sounds as well. Are you able to sit up for me today?
I think so.
Okay. I'm just going to listen to your backside here. Have you been doing your incentive spirometry since you've been in the hospital?
Not as well as I should, probably. It makes me cough, and then I start hurting, and I have to ask for pain medication.
Well, doing your incentive spirometry is something that would be very important to help your lungs stay strong so you don't develop pneumonias. And so one of the things I would encourage you to do is, as you do that every couple hours, ask me if you can have some pain medication. That way we can stay ahead of the pain, and then it possibly won't hurt as much. But it's really good to exercise your lungs.
Okay.
So during your nursing assessment too, you can also use those times to teach your patients and educate on what they could be doing along in your nursing assessment as well. And now I'm going to listen to your bowel tones. Okay.
Okay.
As you're listening to your patient's bowel tones, you want to remember that you have to listen for a full minute if you don't hear bowel tones. As soon as you hear bowel tones, you can move on to the next quadrant. Have you had a bowel movement recently?
Before I was admitted.
And that was
2 days ago, I think.
okay. And are you eating? Have you had breakfast?
Mm-hmm.
Okay, so that might be something we want to look into today, is maybe get you on a stool softener or something like that, especially with the pain medications. We don't want you getting stopped up.
Right.
Okay. You can go ahead and squeeze my fingers for me. Good. Good equal strength, good grips. Now I'm going to go ahead and I'm going to lift up the blanket, and I am going to assess your pulses in your feet. And you want to assess these pedal pulses bilaterally, making sure that they feel equal. Are the pulses bounding, thready? And all this time we're also looking and inspecting for any signs of edema. No edema on the legs. Some of the things that might be cause for alarm is if you have one side that's swelling and not the other. That could mean you have a possible blood clot. And if you do note edema, you want to probe a little bit more. Is this something new for the patient? Do they experience edema a lot? Or is it just because they've been laying in a dependent position for quite a while? And then one other thing, I'd like you to go ahead and push down on my hands. Good. And pull back with both. Good. And this is just another integrating a little bit of a neuro assessment into your general assessment. Okay. And now that we've pretty much finished our initial nursing assessment for the day, you want to make sure you do a few things. First off, you want to document your findings immediately. While you'll probably have 2, 3, maybe even 4 more patients, you want to make sure that you finish up with that patient initially. And then you want to make sure that you have closure with your client and talk about what the plan of care is for the day, and make sure that all safety issues are taken care of prior to leaving the room. A couple things you want to look for. You want to make sure that the bed is locked. You want to make sure the client has their call light within reach, and that they have their 2 side rails up, and that the bed is low and locked. I just said locked a little bit ago. And you want to note too, this person is on oxygen. You want to make sure that the oxygen is actually on, the tube is connected, and that she is on the same amount of flow that was charted from the previous shift. Thank you.